including hospital, retail management, and specialty pharmacy. His vision to give back to the community and really want to make a difference in people's life. Is also excited to share his experience and stories within the next generation of future healthcare leaders. So without further ado, I'm going to pass it on to Dr. Chen, and he's going to talk about our pharmacists. Usually, from my perspective, pharmacists usually hiding behind the counter, right? And they're like, masterminding everything. And also in the hospital, from my perspective, I work with hospital pharmacists. They're very important because they catch all our mistakes. For example, our dosage, correction for, kidney function, liver functions, and also to make sure the interactions that, we don't get into. So our life as a physician really count on being a pharmacist. And I'm very interested to learn about the expanding role of Ontario pharmacists as well, because I think, as we move along, we are running out of family doctors or physicians or patients having a hard time finding family doctors, and pharmacists is now taking a much bigger role, especially during COVID, for example, giving vaccination. And now I think at least 8 or plus different medical conditions, pharmacists can actually prescribe and help us as well. So expanding role for pharmacists. Thank you.
Thank you, Dr. Chow, for the introduction. As he mentioned, I am King. I'm the pharmacy speaker for the day. I have a doctorate of pharmacy as well as being a certified diabetes educator. So today I'm going to share with you guys what it's like to be a pharmacist. So I'll first start off on 3 major topics. One is basically introducing what exactly does a pharmacist do, because you may see all these pharmacists in white coat as shoppers, red soul, and community pharmacy, etc. But most of you probably don't know what we do behind the scene. So I'll let you know what we actually do. Next thing is basically going through my current job as well as my past work experience to see if there is a setting that you guys are interested in becoming as well. Last thing is, if I'm able to inspire you to become a pharmacist, then how exactly do I apply to become a pharmacist then? So a pharmacist's job is not as dry as many people think. We actually have multiple career paths that you can take. For example, you could be a pharmacist in a hospital, or you can go to long-term care, or you can work in retail, become a manager, and even basically become a store owner. Then you can also work in the specialty pharmacy side of pharmacy, or you can work in compounding, where basically you're making medication that do not exist on the market, but the patients need them. Or you can also work in pharmaceutical industry, where you work for big drug manufacturers like Apotex, GSK, etc. Or if you're interested in teaching people, you can go to academia, or become a professor or an instructor. So highlighted in red are the experiences that I've had basically worked in, and I'll be able to show you guys basically what I think about the various settings I've encountered. So a little bit more about me. So I'm a pharmacist, over 6 years of pharmacist experience. I did my undergrad at University of Toronto in the pharmaceutical chemistry specialist program. Then I moved on to Waterloo to get my co-op doctorate of pharmacy. So the emphasis on the co-op, because again, these co-ops are paid. So basically you're getting real life pharmacy experience, as well as basically being able to pay off your tuition a bit earlier as well. Now, as I mentioned, I have exposure to long-term care, hospital, being a manager, as well as working in specialty pharmacy as well. So many of you may wonder, why exactly did I become a pharmacist? So I wish I had some sort of amazing story to tell you, but to be honest, I just didn't know what to do in my life. So unlike you guys who had this opportunity to attend this career inspiration day to find out which career path is suitable for you, I had to do a little bit more exploration on myself. So basically, I wanted to explore myself to find out what exactly I wanted to do with my life. So I did a volunteer, basically locally as well internationally. And in the end, I found out my passion is basically working with people and helping people. So at that time, pharmacists were one of the most accessible healthcare professionals, as one of the trusted one as well, and still is. So I ended up basically pursuing the path to become a pharmacist. So on a daily basis, basically there are 2 aspects that a pharmacist does on a regular basis. There's the clinical aspect as well as the technical aspect. When we talk about the clinical aspect, we are looking at 4 different categories. The first one basically being indication, to make sure that the right medication was prescribed by the doctor for the right thing. Then we move on to basically efficacy, to making sure that the medication works for the patient. Next is basically about safety, making sure that the patient is not experiencing any adverse effects, as well as there's no drug-drug interactions. Next thing is basically a compliance, to make sure that the patient is taking the medication on a regular basis, just because in order for some medication to take into effect, it has to be taken on a regular basis. And after taking all these 4 categories into account, then we move on to the next step, basically is counseling the patients to basically tell them how you take the medication, how to store it, and what side effects that you may experience. And during this process, let's say if we identify patients who may benefit from a medication review, then we basically will go through the medication list to optimize the therapy. Now, the other side is the technical side. Basically, it could be basically the injecting the flu shots or the COVID shots that many of you may be familiar with. The next part is basically is also doing the insurance part to make sure the patient has some sort of coverage to cover the medication, as some could be quite more expensive than others. Last part is basically just dispensing the medication to make sure the right medication and the right dose was dispensed. Now, one of the most exciting field that was given to us as authority as a pharmacist is that starting this year or January, we are now allowed basically to prescribe for certain medications. So what exactly I'm talking about is 13 minor ailments. So basically, this minor ailments basically means that these are the common infections or diagnosis that the doctors see, but usually they're not as complicated as others. So this is where the pharmacist can step in, assess the patient to see if any dangerous signs where they could be seen, that they must be seen by the doctor, or it could be dealt locally in the pharmacy. So after we assess the appropriateness, then we're able to prescribe for the patients. So listed on the slide basically are the different 13 medical conditions in which we are allowed to prescribe now. So in terms of my current job, I work at McKesson Specialty Pharmacy. So specialty pharmacy is much more different than the community pharmacy like shoppers that you see, just because again, we're dealing with specialized medication. And these are specialized because they are life-saving and for rare conditions. So often much more expensive than usual. Usually looking at $1,000 to $20,000 per dispense. So as you can see, not all drug insurance are willing to cover for the medications. So this is where the specialty pharmacy or side will kick in to make sure that the patient gets some free medication or some sort of way to control the symptoms. The also benefit of basically working in specialty pharmacy is that you develop specialized knowledge, such as basically become an expert in cancer medications or rare liver kidney diseases. And obviously, my daily routine does not escape from answering drug-drug interactions, counseling the patient how to take the medication, and also as following up with patients to make sure that they are also taking the medication as prescribed. Now, in terms of where I worked, it's impossible to go into details about what exactly I did, but I did want to share some summary and distinctions that might help you decide on which setting that you want to work in the future if you decide to pursue the pharmacist profession. As I mentioned, basically I work in retail, manager, hospital, as well as long-term care. The first deciding factor that you want to think about is what kind of patient interaction you want, because there are 2 types. There's a direct patient care as well as indirect patient care. So basically, direct patient care means that you're talking to the patient face-to-face and you're solving the problems in front of them. The other part is the indirect patient care, where basically you kind of work remotely. You basically could be in the basement, and the patient could be up on the floor somewhere, and then you're still trying to help them by making sure that the medication that they got is still appropriate. So if you like direct patient care, then working in retail is a perfect environment for you because patient will come to ask you directly for over-the-counter medication. You'll also be counseling patient directly as well. But then when you move on to become a manager, sometimes you get more indirect patient care because you be more focused on the business side and operations of pharmacy. Now, if you work at a hospital, otherwise, for the most part, it's going to be indirect because again, you'll be working in the basement of the hospital. And there are some times when the pharmacist does go up to the unit to speak with a patient, but again, that is pretty rare. The next thing is if you work in long-term care, it's just going to be indirect. Now, the next thing is about being on call. So in case nobody knows what on call means, it's basically that they will give you a work phone. And then after your shift ends, they may or may not call you to ask for some questions. So this is applicable for patients, for if you're, say you're a manager, for example, they will call you after work to make sure that the pharmacy is still operating as basically scheduled, essentially. Or let's say if you work in hospital, there is potential that you might be on call as well. Sometimes like at midnight, a doctor could be asking you a clinical question that you got to address. Now, the next category is about lunch break. I know it's probably like a shocking thing to put on there, just because again, everybody will probably think that lunch break is like a mandatory thing for everybody, right? No, not necessarily. Depends on which setting you work with. So let's say if you're in retail, for example, you are definitely not guaranteed a lunch break, just because patients come at different times, and it will depend on how busy the pharmacy is at that time in order to basically have your lunch break. Same thing with basically being a retail manager as well. But if you work in hospital, you are guaranteed a lunch break. And then if you work in long-term care, you are almost guaranteed a lunch break as well. Now, the last part is basically depending on your preference on what you like to do with your life. If you're looking for something that's always the same and it basically you won't get bored from doing it, then basically hospital might be something that you might want to consider, because every day the life is going to be very similar essentially. But if you like something that's more changing and exciting, then basically retail will be the same thing for you, because every day is going to be different, and we will be having a busy day one day, the next day you could be pretty chill. Now, as with every profession, there are some goods and bads of being a pharmacist. So I would say the best thing about being a pharmacist is that, once you finish your shift, unless you're on call, your day is done for the day. This is unlike other professions. Let's say if you're a doctor or you could be an accountant, where you have to dedicate extra hours outside of work to get the things done. Now, the career itself is basically paid on an hourly basis. So if the more you work, basically the more money you get. So that's something that you're interested in, that's something you can pursue as well. Last thing is basically now we're able to prescribe for certain minor ailments, and more could be coming towards the end of the year. So if you like having the prescribing power without becoming a doctor, then it's something you can consider as well. Now, the downside of this is that I would say there's still the public perception of pharmacists being pill dispensers. There are patients who bring the script in, and they can't demand your medication to be dispensed to them within 5 minutes. But as you probably got from my slide, it's not as simple as grabbing something off the shelf. There are all those things that we got to think clinically to make sure that the medication is appropriate for the patient. So these are the times where you will have conflicts with this patient, and now you will have to basically explain what is going on and address it on a daily basis. The other thing is that depending on which work environment you work in, you might be standing all day. And that long-term wise is going to cause some knee pain for you. So that's something to consider as well. And the last part is, again, depending on what setting you work in, you are not guaranteed a lunch break. So if I am still able to convince you to become a pharmacist and not scare you away from the profession, then how exactly do you apply for the pharmacist profession? So in Ontario, there are 2 schools. There is University of Toronto as well as University of Waterloo. There's also University of Ottawa, but that's a French school, so I won't mention that today. But in terms of how to get in, basically it's either 70% or 75%. But don't be fooled by these low numbers, because most of the people who get in are the people who are greater than 90% average. The other thing that people are not aware of is that for University of Waterloo, you can actually start applying for pharmacy school straight out of high school. So I'll mention that a bit more on my next slide. But for Toronto-wise, you basically need to do at least 2 years of undergrad before you can apply for pharmacy. There's also the CASPER test, which is part of the admission requirement, but again, I won't go to that as well. But in terms of how to interview candidate, there are slight differences. For Toronto, they do a multiple mini interview. Basically, that means that they're giving you 10 stations in which each station is different. And then what they're looking for is like your ability to think on the spot the ability to communicate, and the way that you deal with things. But for Waterloo-wise, it's more a formal process where basically it's like a 2 or 3 man panel interview where they ask you questions like, why do you want to be a pharmacist, and so on. But there's also a way to make yourself stand out, because they give you 10 minutes to showcase yourself before the actual interview. So at this time, you can introduce yourself as an individual. You know, you could be playing a guitar, you can be singing, something to make yourself stand out. Now, theoretically, getting into Toronto might be a bit easier just because it's 240 students versus 120 students versus Waterloo. But again, that's theoretically, just because a lot of people want to stay in the city and they want to go somewhere rural in Waterloo. So technically, a lot more people applied for the University of Toronto. So it's more competitive in that kind of sense. Last thing is about the pharmacy clinical experience that you will get. So if you stay with Toronto, it's going to be volunteer. But for Waterloo-wise, it's going to be a paid experience. So that's something you want to consider as well if you want to pay off your tuition a bit earlier as well. Now, I won't go into in much detail about this. Again, this is literally found on the Waterloo Pharmacy website. But basically, you can apply for pharmacy if you have a high school average or greater than 90%. Then it's a conditional offer, because once you get accepted, you still got to do 2 years of university before you transition into pharmacy. So obviously, in terms of how to get in, besides being academically strong, you basically need somewhere to make yourself stand out. So it could be something like, you can create your own club at the university, or you could become a president of some sort of club, or maybe become like captain of a sports team, for example. Now, in terms of where the career of this pharmacist is heading, is it too late to join the profession? Is it going downhill or uphill? So I wish I had a more up-to-date statistics for you guys, but at least back in 2016, the people who graduated that year, 90% of them found a job. And that's actually pretty a high number, because there are some jobs after you do university-wise, it's like a 50-50 chance of you finding a job afterwards. So if job security is important to you, that's something to consider as well. But in terms of a smaller pool of data, I talked to basically some of my friends who graduated a year ago. They basically said that, the people I know all found a job, if that's comforting in some sense for you guys. Now, in terms of more up-to-date data, basically in 2022, most of the pharmacists basically work in retail. There are some working in the hospital, and the rest is just scattered elsewhere. So again, ultimately, it depends on which setting that you want to work with. And that was it from me. So if you have any questions, I'll be here to answer them after, I guess, the dietitian Rowena does the presentation. Thank you.
So thank you, Dr. King. We learned about what pharmacists can do, and debunk the myth of just standing behind a counter. They do a lot, and as physicians, we count on them all the time. And I think with the healthcare world, they're